So how damaging is, if someone has type 2 diabetes, is it to the pancreas and things like that? Does it affect that organ a lot? Is there damage that's caused?
Yeah, there absolutely is, and there's a phenomenon that's known as glucolipotoxicity to the pancreas, and what that term means, it means that the blood sugar concentration becomes so high and the blood fat concentration becomes so high that the pancreas almost shuts down. There's very fascinating research that shows that the pancreas is actually still able to make insulin. It still packages insulin in these little vacuoles within the tissue, but it actually doesn't release that insulin normally. And there's also a sort of a retraction of many of the receptors on the pancreas that help detect the concentration of glucose, as well as help detect the concentration of insulin and help it release insulin normally. So when the cells of the pancreas sort of retract all those receptors, the pancreas is still there, there's still some function, but it's not really doing its job physiologically anymore.
But if we employ some of the lifestyle changes, can the function of that organ, of the pancreas, get back to normal? Can it reverse?
Yeah, I believe it can. You know, this is an area of evolving research. There's a lot of research interest in terms of restoration of beta cell function. The beta cells are the cells that produce insulin. So that's considered the holy grail of type 2 diabetes therapy, is being able to actually recover and restore that insulin production in the pancreas. We have some medications that have some suggestion of being able to restore pancreatic function. And then, you know, my approach is to resolve that glucolipotoxicity, to bring the blood sugars down to the point and the blood fats down to a point where they're no longer causing inflammation in the vascular system. And then there's a chance for the pancreas to actually show some signs of recovery. And I do see improvements and increases in insulin secretion when patients are in very, very good control. That is, we get their risk factors down to very, very tight levels.